Cimavax is a vaccine that they have treated 5,000 patients worldwide with lung cancer, 1,000 in Cuba, and they've done very extensive, large clinical trials that show that patients getting Cimavax, in fact, live longer than patients getting standard of care. So with very minimal toxicity. Because the Cubans and the CIM really didn't have the resources to individualize therapy for every cancer patient individually, what they did is they developed a vaccine that actually, instead of targeting the cancer itself, targets a circulating growth factor called EGF that the cancers need to survive. So essentially it depletes this growth factor out of the blood and the cancer starves. The very exciting characteristics of this vaccine is that it works, it prolongs people's survival, it has almost no toxicity. It is easy to give, it's a shot in the shoulder once a month, and it is cheap. We figure that it's probably $1, maybe $2 a dose. The really exciting piece of this is that it's very useful for the treatment of cancer, but the really exciting thing that we were sort of completely taken with is the idea that you might be able to use it to prevent cancer. And not the idea that you could simply vaccinate 5-year-olds and prevent them from getting lung cancer. I think that that's probably a little bit ahead of things. But the idea that you can vaccinate somebody that is at high risk to get cancer, lung cancer. So we have a very clear group of those patients right now. They are patients that have lung cancer in an early stage that is surgically removed. Those patients are technically cured, but we know that many of them are smokers and they've damaged their lung lining all over the place. And so they are at very high risk to get a second lung cancer. So what do we do with those patients right now? We just watch them. But if you could vaccinate them and reduce their risk of getting a second lung cancer, that would be a huge advance. I believed it from 2011 when they first presented this vaccine, and I said to myself, wow, this is a game changer. If we can use it the way that will impact the most number of people, again, potentially in that prevention setting, this will be a game changer.